With us on telephone call is Dr. Thamra bint Said Al Ghafri, Director of Planning and Studies, member in the Regional COVID-19 Operations Center. Dr. Thamra, thank you for joining us at Oman Television.
Thank you. Thank you so much.
Now, Dr. Thamra, we have, of course, gone through this particular video here on the operational center. Could you elaborate more on the role of the Regional Operational Center in responding to COVID-19?
Yes, as you correctly said, the Regional COVID Operations Center is under the direct command of the Directorate General of Health Services in Muscat region. So basically what it does, it executes the policies and the guidelines that comes from the national medical and public health response teams. It oversees all the actions and the activities that are put in place to prevent and control the transmission of COVID-19. The center also provides the necessary and the comprehensive coordination and the support within the sectors involved in managing COVID-19. And also, it's important to mention that the center really exerts every effort to enhance the capacities towards screening, detection, and managing cases of COVID-19.
In these particular cases, what are the teams involved in the center?
When the center initially started, it started with a task force that was in January 2020, but as the cases were increasing and with the cases surging and building up, more and more teams were involved in managing these cases. So I can, for example, there are currently 13 teams working hand by hand to deliver and do all necessary to control COVID-19. So I can very quickly go through some of the teams. We initially had a team taking care of the ports of entry. Here I meet the Muscat International Airport and also the seaports. We had the primary healthcare and supportive services, which is a very essential team because, as you all know, it's the first line of defense and it's the gate for everyone through healthcare. We have the infection prevention control team that does all the training and providing the necessary supplies. We've got the disease surveillance and response team that takes care of the suspects, the positive cases and the contacts. We have the health information team, system team. We've got the health services for isolated and people who are under quarantine. And of course, this team is very important because they are the ones who deliver all the support and even the mental and psychological support for people who are under quarantine. And of course, there are other teams that provide on a daily basis the logistics, like the pharmacy, medical supplies, the admin, the finance, and so forth.
Dr. Thamra, have you encountered any challenges?
Well, definitely when you deal with a public health emergency such as an infection, there are certain challenges. And I guess these challenges are constant internationally across almost the world. Everybody knows about the shortages of supplies that everyone is talking about. However, with all the efforts from the national committees to make all these supplies available, we are really doing well so far. There is other challenges are really to the media and the role of media in creating the awareness for the public to really stay at home and stay safe. Because if you think about it, the core and the essence of preventing this disease is really the community, is to stay home, stay safe, and keep on practicing hand washing. If everybody does what it's supposed to do, I think we will all be safe.
Dr. Thamra, thank you very much for speaking to us on Oman Television. We really enjoy the wonderful collaboration of all 13 teams. We wish you all the best, and we hope that the message will reach to each and every one. Thank you very much.